Hello guys, this is Dr. Palani Pramanikam. In this video, we're going to talk about what is high blood pressure, how do you find out whether you have high blood pressure, what is the easy treatment for it, and what can be done to prevent the complications. Let's dive deep into it. So what is high blood pressure? High blood pressure means there is thickened and stiff blood vessels which is supplying your heart, brains and kidneys. If there is blood supply to these organs or compromised because of the thick blood vessels, the organ gets damaged, leading to heart disease, stroke and also kidney failure. So we need to find it early to prevent these complications, because you will never know that blood pressure is going on until any kind of complication happens. I had a patient who never had any problems with blood pressure at all of a sudden comes with a stroke-like symptom with a blood pressure of 180, which means it was not monitored or caught early, and hence it is very important to check blood pressure for everybody who is over 18 years of age at least once every 2 to 5 years. So if you are a 40-year-old, you need to check your blood pressure at least once every 2 years and make sure that the number is below 120 over 80. The top number is called systolic blood pressure. The bottom number is called diastolic blood pressure. More than 120 in the numerator and more than 80 in the denominator suggests that you have some kind of elevated blood pressure. It is classified as normal, mildly elevated, stage 1 and stage 2 based on the numbers. So let's say you are completely healthy, you don't have any medical problems, you walk into a pharmacy store, check your blood pressure and your blood pressure is high to 140, and you keep checking 2 or 3 days and it is continuously high. That should be a wake-up call for you that there is something going on in your body, suggesting that there is an ongoing inflammation. And people think that salt is the main reason for elevated blood pressure, stress is the main reason for elevated blood pressure. Though all these factors contribute to it, the main reason is actually insulin resistance. The hormone insulin that we worship in this channel is not working for you. It doesn't mean that you are not producing insulin. The insulin that you are producing is not working. That is called insulin resistance, and let me explain how that happens. So insulin is a hormone secreted by your pancreas whenever you have glucose inside your body, which is food. When you eat carbohydrates, which is included in rice and multiple other sources, insulin is secreted to digest the carbohydrates. But the problem is we eat more than what we need, and also we eat at multiple times throughout the day, mainly at night where the insulin is sleeping. So basically we are targeting insulin at two different angles. One, we are eating more than what we should. Number two, we are eating at the time that we are not supposed to, like late night where insulin is actually sleeping to take some rest. So for the first 10 years, for example, from 20 to 30 years of age, you will not feel any damage at all because insulin is trying to cope up with it. But after 30 years of age, you will start to notice slowly the insulin fatigue, which means that insulin will not do the work. You will eat carb, insulin will be secreted, but it will not digest the carb. This is called insulin resistance. Your body is filled with insulin but good for nothing. So what happens to all the sugar that we are eating, like the carbohydrates? It doesn't have any hormone to digest. So the sugar gets converted into fat and it gets deposited in the blood vessels, and that is the starting main reason for high blood pressure. Even in my family, when people think that they have high blood pressure, the first thing they are stopping is the pickle. Actually, what they should stop is the second round of rice that they are putting on the table. Let's say that your blood pressure is elevated more than 120 in the numerator and more than 80 in the denominator consistently on 3 different occasions. You do meet the criteria for hypertension. Ideally, you don't need any significant medication to decrease the blood pressure, provided you make changes in your diet and lifestyle. And the key factor in diet and lifestyle is to preserve the insulin quality. We talked about the 2 different angles insulin is getting damaged. One is over calories, 2 is eating late at night where insulin is sleeping. We could control both with fasting. So now we know that insulin resistance means we do have insulin, but the insulin is not working because it is very tired. So we need to give rest to insulin. For that, we need to cut the amount of food that we are taking in, which will in turn decrease the effort put by the insulin to digest this food, which means that insulin has time to recover. So for this to happen, any kind of fasting is okay. For the first step to happen, all insulin needs is 12 hours of rest. And you could pick a time that works for you. You could start start from 8 a.m. to 8 p.m., 9 a.m. to 9 p.m., 10 a.m. to 10 p.m. It doesn't matter as long as it has 12 hours of rest. When you are following the first angle, if you can follow the sleep-wake cycle of insulin by eating in the morning when insulin rises and completing your dinner when insulin subsides down, the outcome is even better. 7 a.m. to 7 p.m. would be the best case scenario if you want to get the maximum outcome of insulin. This is the first angle. The second angle to this is low carbohydrates. Remember, insulin digests glucose. So when glucose is not there is no work for insulin, which means there is more recovery time for insulin. Again, remember, the problem is not that we don't have insulin. Problem is we don't have good quality insulin. Even in diabetes, when they are giving artificial insulin, doesn't mean that you don't have insulin. Because we have poor quality insulin, we need more insulin to do the work, which means our insulin levels are super high, but it is just resistant. So when we are decreasing the carbohydrate content, the workload on insulin goes down, which means that the recovery is faster and it will be able to digest the carbohydrates more. So the sugar to fat conversion is stopped right there. And the third angle, how you can decrease the workload on insulin, is not to eat anything processed. If you eat natural, whole grain, fruits and vegetables, and you don't eat anything in a package or in a bottle, your insulin will love you, because anything that is processed or packaged usually contains added sugars. Again, sugar is the reason to trigger insulin. When we are avoiding packaged foods, processed foods, and if you're eating whole grains, fruits and vegetables, your insulin would absolutely love you. The insulin resistance will decrease. It will start to work again. It will digest the carbohydrates. So the carbohydrates to fat conversion is decreased, which will in turn decrease your blood pressure, which will in turn decrease your heart disease risk. Of course, all the other additional steps like, meditation, decreasing your cortisol levels. Of course, decreasing salt is going to help. Decreasing your stress level is going to help. But let's be honest, we really don't have that much amount of time in this busy world. If you want to focus your limited time in a particular area, I will really focus on decreasing the workload on insulin, increasing the quality by following these 3 steps. Number 1, fasting with a minimum of 12 hours, as we discussed before. You can maximize to 16 hours. Number 2, decrease your carbohydrates intake. Just decrease the second portion of whatever carbohydrate that you're eating. Take this as a challenge and see what happens to your blood pressure. And number 3, avoid anything processed, anything packaged. Try to be as natural as possible. Eat whole grains, raw fruits, vegetables. If you or any of your family members have been diagnosed with high blood pressure, please consider this as a 2-week challenge and then see whether you can do these 3 steps. You can check your blood pressure before starting of the challenge, and you can do this 2-week challenge and measure the blood pressure after. I guarantee you that you are going to see decreased blood pressure readings, and if you keep doing this on a long-term basis, you might be able to come out of medications altogether. I'm seeing young people with high stress levels, high blood pressure, leading to stroke to a point that they cannot even move their arms and legs. It is very sad, and my heart goes out to their family. It is a problem of not understanding that wake-up call, and hence I urge everybody above 18 years of age to check your blood pressure at least once every 2 years. Remember the number 120/80. I will put that in the description. And if your blood pressure is more than that, please take this as a 14-day challenge of those 3 angles that I said, and you will see the results by yourself, and write down in the comment section. Remember, one belly at a time. It is absolutely important. I'll see you in the next video. Bye-bye.